Well, welcome to our conversation between Medical Ambassadors International and Meros. And we're joined here with Jason and Steve, who have been working with Meros, and with another Steve, who is the CEO of Medical Ambassadors. I'm going to be hosting today. My name is Tim Cowley. I'm the Director of Global Engagement and Communication for Medical Ambassadors International. So we will get started with a little bit of background on who you guys are. And let's start first with Jason.
Yeah, thanks, Tim. My name is Jason Pulitzer, and my background is public health. Public health, got into missions, never really wanted to get into research. I was just all about practice. And when I got into practice, I started to have all these questions. Well, how do we know this? Is there a better way to do this? Are we sure this is the best way? But what about this? It seems to be coming up again and again. So having that experience in the mission field in Zambia specifically kind of motivated me to move into the research space, but not just to publish papers, to actually inform practice, a direct link to how we can do better. And after a journey in the mission field and then in academia and then back in practice, I was blessed with the opportunity to start Meros back in 2021. That really converges my mission experience, my public health passion, and a desire for research and integrating research into practice for organizations like MAI. So it started this. I'm the founder and director in 2021. It was a joint collaboration between Kingdom Workers and Wisconsin Lutheran College, both institutions having a strong faith, a Christian identity, but also knowing that we can help the church love well through evidence. And that was the motivation behind starting the Meros Center, walking alongside organizations like MAI to be collaboratively curious in this space of Christian health and development.
Okay, thank you, Jason. So help us to kind of categorize Meros. Is it a mission agency? Is it a public health agency? Sort of where would you say it fits in this ecosystem?
We're a research center. We are a mission-driven research center, if you want to put us in a category. We don't get into implementation. We let Steve and MAI do that. But we help develop and answer interesting questions that can motivate that. So I would say we are a mission-driven research center.
Great. Thank you. That's helpful. And Steve, so what's your place in all of this? Are you part of Meros? Are you an independent research guy? Tell us about your background.
Yeah, so I am a Meros Fellow, and I'm also an academic. I'm a fellow at an Institute for Studies of Religion at Baylor University. I'm a sociologist by discipline, but like Jason, I have a missions background. So I've spent some time in Africa with a group called African Enterprise, whose mission is to evangelize the cities of Africa in word and deed. And also World Relief, which is the relief arm of the National Association of Evangelicals. So I try to live in this nexus between academia and Christian development, and do research around those areas, care deeply about global Christianity, what is going to make the global church healthier, and how can we empower people, especially in places like Africa, Asia, and Latin America, as they seek to live out the gospel in the fullness that is there in the Bible.
Thank you. Okay, and then Steve from Medical Ambassadors, give us a little bit of a look at your world, how you got to where you are, and then follow that up with Medical Ambassadors, a brief intro there.
Yeah, sure. Thanks, Tim. So yeah, I've been the CEO of Medical Ambassadors for a little over a year, and I was actually in the biotech space for about 15 years. So in kind of the secular world, doing laboratory research on new pharmaceuticals. And so I did that and always felt a calling to the mission field. And our family moved to Cambodia for a few years in 2012. and spent some time in Cambodia, just, doing discipleship, coming alongside the local church, teaching English, and just doing whatever, doors, whatever God was opening, whatever doors God was opening. And after we moved back home, I got kind of into the community development space, working with an organization called World Challenge, where they were using Che, and they needed a regional director for Southeast Asia. And I'd lived in Cambodia, I knew the language a little bit, and so spent a lot of time in Cambodia and the Philippines and Laos and Myanmar, training local people in Che and coaching them and just encouraging them, local churches and partners, to facilitate Che in their local communities, essentially. And then about 4 years ago, I came over to MAI as the global coordinator, and just more of a global role, and then moved into the CEO role last year. MAI is an organization that has been around for, I think, 45 years, and maybe a little longer before they were registered. It was actually started by a doctor, Dr. Benson, who was going over to Africa, I believe, and Vietnam, bringing Christian medical professionals over there to do medical clinics. And, it was doing all this great work and also trying to evangelize and share the gospel with people. So it was a very integrated ministry of, health and, the spiritual side. And then when the second president was appointed, there were just some things where they thought, well, one of the challenges that we're seeing is that a lot of the diseases that we're going over and helping cure are preventative. And so people are getting stuck in sort of cycles of poverty because of preventable diseases. I mean, we're talking 75, 80%. If they just had kind of the knowledge, the ideas, maybe some techniques on how to prevent these things like typhoid, they wouldn't, lose their job and have to take out loans and go into debt, and their children would be able to go to school. So they shifted to a whole new paradigm of kind of a whole life-centered approach that focused on prevention over cure, that focused on local ownership. And that is where sort of Che was kind of fully came together. I mean, there's a bigger story behind that, but Che is community health evangelism, essentially. And so, like a lot of the values I just talked about, prevention over cure, local ownership, local resources, holism, developing people over projects. Those are all sort of the ideas that undergird community health evangelism. And so MAI kind of spearheaded that, was implementing for many years. And then I don't know exactly what year it was, but kind of some of the people from MAI left and spun off what's called the Global Che Network. So MAI were still implementers of Che. We also use some other, other types of techniques and strategies globally, but we still have the same core idea, the same general outcomes we want to see.
Okay, awesome. And so what is the inciting incident, or what is it that kind of brought us together, MAI and Meros? Do you guys remember, were you anyone around during that time who can tell the story?
Terry Dalrymple's what's his title, the director of the Global Che Network?
I think so. Mm-hmm.
So I met Terry when I first moved to Phoenix, and we got talking about what does it look like to bring Che to students, and have it be part of a public health training, because the foundation of community health evangelism is public health. A lot of health promotion, community development, sort of principles and theories. And working at a place like Grand Canyon University, and then I eventually went to Baylor University, that was an ongoing conversation. So in 2021, the driving question was, in order for Che to really be embedded in an academic platform, does it work? And what's the evidence base for it? Like, what are the core competencies that a student would need to know in order to effectively implement community health evangelism? And we couldn't answer that question cleanly. We had the principles, but exactly what does that look like in the field? Like, do you need to be a good facilitator? And if you're a good facilitator, what does that actually mean? Especially in the world of community health evangelism. Holism. What does that actually mean? And how do you know when you're actually having a holistic health approach in the field? So these were some of the questions that if we were going to have more of an academic program, we needed to answer in order to explain the competencies. So in 2020, 2021 or so, Terry got a small grant that kind of got us started with, let's start studying Che. And so we had $7,500 to get some students involved. And that was the initial study in Guatemala with Global Che Enterprises that then led to a study in Ghana. with MAI partners. And that was then the connection. And I had known Victor Chen from prior International Holistic Missions Conference, so the partnership was pretty natural and organic, with all of us kind of working together to build the evidence around community health evangelism so that we could just better train people and equip practitioners in this space.
And then I think it was maybe 3 years ago, and I'd just come into MAI and I had started asking questions as well. And I'd even done this in my last workplace. It was like, how do we really know this is working? We hear a lot about how many communities we're in, how many trainings we've done, how many people have gone to the trainings, a lot of good things, a lot of great activity. But I just began to ask, is there any evidence, like Jason said, that this is actually accomplishing what we think it will accomplish? I mean, when you sit and you get to experience it, the facilitation and the community facilitating things, it's very exciting. It's very inspiring, and you could see how it could work. But on the other side of that, is it working beyond just the people going to a training? And so I was asking that question too when I was at World Challenge, and started to work with a guy named Calvin Edwards, who has an organization where they work with a lot of foundations to go out and test impact of different Christian organizations. And, something he even said to me that was saying, many years ago, people would ask, they would just give money because they believed in the founder. Let's say the Billy Graham, they'd be like, we just trust Billy Graham. We will support him. David Wilkerson, we just trust him. And then move from that to, well, we trust the organization. We trust World Vision. Like, we don't really know, but we trust them. We trust, places like that. And then today, more and more people are starting to say, well, I don't really trust individuals so much. I don't really trust organizations so much, kind of prove it, basically. And so that really, not only for the donor side, but too, coming from a scientific background, I'm always like, prove it, prove it, prove it, prove it. I used to be really into apologetics, and so that's always just been my slant. And so when I came over to MAI, I started asking the same questions. We'd done a couple of studies over the past 30 years, a huge one in the Congo, a heavily funded study. I think it cost 150 to 200,000 at the time, and that was done in the early 2000s. And it's a great study. A lot of great data came out of it, but we haven't done so much since then. And so I just started asking that question, and our former president was able to work with the foundation to get us a fairly good grant to develop sort of what's called a rapid impact assessment. And so that's when I was like, well, who else could I work with? But I was like, Jason, we had met IWMC as well, and we had been talking about the Ghana, small Ghana study that had been happening. And I thought that just seems like a natural next step to partner with Meros, because I don't have the capacity or the skill set to really develop this myself, and we didn't have anybody in-house to do that. And so that's where we thought, a strong collaboration with a trusted partner would be the right way to go.
And so what does it look like? Where are we at now? What's already been done? What are we, let's talk some outcomes as well. Catch us up to speed if we don't know the details of what this partnership means.
So we are ending phase one, kind of moving into a phase two. We are in phase two, probably midway through phase two. Phase one was really meant to just know what we don't know, kind of step back a little bit. And Steve was really involved with working with an advisory committee, identifying just what do we actually want to measure, because there are a lot of things we could measure. And Steve and I had conversations about, really what are the core principles that we want to look at. And so working with an advisory committee, doing some participatory learning, which is a bedrock of CHE, so it's an established method. People are familiar with it, but it's basically an approach to help create a shared pool of knowledge that we can all work from, and bringing together the advisory or some of the country leads, program leads in different regions. Because that's one of the interesting things about MAI is the number of places where they're working and supporting different communities, different makeup of church-based, community-based, government-based. Like, there are just so many different flavors of how you can implement community health evangelism. It makes it a challenge to really hone in on what are the impacts, because it could be related to different things, which is kind of the issue of confounding in a research process is do we really know it's associated with this thing that we think it is? Che being that thing. And so that was phase one, was just understanding what we don't know and then leading into a core group of domains. So working together, we identified a few domains that we felt really represent what we want to see and what MAI wants to see in a Che program. And that was community connectedness, and capacity and agency, and spiritual integration. So those three really became sort of the core focus for us as we moved into phase two to start developing the tool itself. And so that's where we are now. As we completed the first pilot, we're moving into a second pilot where we're going to test the tool in 4 additional countries and locations. And then we'll do it again for a third pilot to see, are we getting relatively clean signals from a diverse group of communities? Because we're already seeing some really interesting insights from mainly Christian compared to mixed communities, where it's not so much just Christian. You have to be more sensitive into how you ask the questions, but we want the questions to be similar enough between the two where we can create a really usable dashboard for MAI leadership and practitioners in the field, so that the information can go both ways in terms of having an effective rapid impact assessment tool that delivers information pretty quickly. It's one of the challenges of the typical research process is the time between a results and publication. It's like now in today's world, 12 to 18 months to get a paper out, people have already moved on. So part of this challenge is getting a consistent rhythm of data collection for MAI that hits on these core areas that just help a community know, are we moving in a good direction? I didn't want to say right direction, but in a good direction that aligns with MAI's mission. So we're in the middle of pilot 2, phase 2 of a 3-phase project.
So what are some of the issues from the past that you would say we're trying to improve upon? Because, there's probably a lot of organizations that have vast guesstimations of their impact. Has that been a case at Medical Ambassadors? Maybe Steve, this might be more for you to answer. Tell me a little bit about how you're trying to change the mathematical numerics of our impact.
One of the things that, I've just been learning, because this is not my area of expertise, but I've read a lot of books that have really been insightful to me, and of course spent time with Jason and Steve and others and learned a lot, and I'm a learner. So activity and impact are not the same thing. And to be honest with you, a lot of people don't fully understand that. A lot of nonprofits, unfortunately, don't understand that. A lot of Christian nonprofits don't understand that. And so they'll talk a lot about, here's my impact report. And the impact report is how many people came to a training, how many people were trained, how many meals were given, how many latrines were built, right? Those are not bad things. They're actually, they're good things. They can be very good things, and they can lead to incredible impact. But in and of themselves, those are not impact, right? It's like leading and lagging indicators is another way to look at it, right? If you go to the gym 5 times a week and you spend, you say, I was on the treadmill 5 times a week at the gym, right? Well, number one, how long were you on the treadmill? But number two, what the real impact is, has that impacted your cardiovascular health? Have you actually lost weight? Are people who are doing that living longer? Are they happier? Do they have better relationships? Are they mentally healthier because they spent time on the treadmill? Those are impacts, and it's really hard. I mean, I'm not an expert in this, but I know it is really hard to do that and to measure those things. It takes a lot of really smart people, like these guys. It takes time. It can take money. And especially when you work like MAI does, where we're trying to work all around the world, trying to share this tool and these ideas with as many people as possible because we believe in it, but we don't have a huge budget like some organizations might, where they might be able to hire, 10, 20, 30 monitoring and evaluation people. We don't have any monitoring and evaluation people. And so we have to recognize that. And we also work through partnerships, local churches and organizations that are overseas, right? So you have to look at what is their capacity, what are their abilities. And so it's a real challenge. So I don't fault MAI for not doing this in the past. And we have done a few that have been funded by a donor here and there, right? We had one in Ethiopia, there was one in the Philippines, there's one in Congo over the past 30 years. But I think we need to do more, and we need to do something a little more consistently. But also at the same time, I'm a true realist. I'm not a pessimist most of the time, but I'm a realist. And I recognize we can't do this in every community that we're touching. We can't. But could we develop with this partnership something that's simple enough that we could do in 25 or 30 communities every year out of the, hundreds and perhaps thousands of communities that we're touching? Could we do this consistently in 25 to 30 a year and at least help us kind of just continue to develop that credibility? And also for our own sake, is this working? Can we celebrate what's happening? And even beyond all that, what are we learning? Like, if it's not working, I really want to know. I think that's actually just as valuable in saying it just works all the time. Because honestly, I hate to say this, you will hear this from some advocates of the strategy that it just works. Steve-O, that's what people tell me, it just works. Like, why are you trying to prove it so hard? I'm telling you, it works. It's a lifestyle. I'm like, I can understand the passion, and they've seen things and they've heard some anecdotal stories from some people, that are powerful. But I think we need to do better, to be honest with you. And I was really inspired, honestly, by Tier Fund. They, of course, a huge organization. They do a similar thing to Che, quite honestly. And they've done some really strong studies. And I found one a few years back, actually. And they literally said, we did all this work in this country in Africa. We went in and we did a deep dive study, and we recognized it didn't do what we thought it was going to do. And they fully published this on their website. And I thought, you know what? I respect that so highly as a Christian, as a leader, as a donor. I actually respect that. I would support you because you are willing to say what I don't think a lot of people are willing to say. And I want to follow suit. I want to be similar to what I saw there. I'm not saying they do everything perfectly, but as much as possible. So that's kind of the story as far as I see it.
Yeah, show us the evidence. Steve, with Meros, let's get nerdy for a little bit here. Are you a numbers guy? Do you have some stories that can go a little bit deeper in the data and sort of data analysis and compilation?
Yeah, I do some numbers, but I'm a mixed methods guy, and I'm serving more on the qualitative side here in this area. And it's been interesting to kind of think about, like, how do you use tools like, we call it a PLA, participatory learning activity, to generate conversations and relationships that matter to the communities that you're in, and they feel like they're part of the process, and also generate data that can swim upstream and be useful on a dashboard, and have that in a concise, digestible format, so that people can really see, what the impact is, so that it's both a blessing to the communities where we're extracting data, and also to the people who really care deeply about the impact that these organizations are having in the field. And so there's a lot that goes into that. And I think one of the really interesting things that I've gotten to do is have conversations with some of the field staff in MAI, and just to understand the depth of their faith, their commitment to their work, the diligence that they have, and the desire that they too have for understanding the impact that they're having. It's really, really remarkable, the kind of people who have been attracted to MAI and the privilege it is to work with them.
So are you referring to regional coordinators that are based overseas, not in the U.S., right? And where are some of those communities, if you're able to share, as long as there's not a security issue?
Yeah, I'll get country level, and then if there isn't a security issue, someone else can drill down a little bit more. But Indonesia, Kenya, Egypt are three places that we've recently had some really meaningful interactions. Earlier in the process, China was also a place where we got a lot of helpful knowledge about how to think about these things. Those were probably the four countries that I was most exposed to and built the deepest relationships with the regional coordinators.
And then where are we hoping to focus in the future? Do you have some other regions already picked out?
Argentina is on the docket. Jason, maybe you can kind of remind me who the others are that are coming up here.
Togo, Congo, and Indonesia again. I see Steve shaking his
Actually, I think it might be Cambodia. Is it Cambodia
Cambodia.
instead of yeah, yeah, yeah. Southeast Asia again.
Yeah.
And when you guys mentioned dashboard, if it's hard to know what does this look like. Are we looking at a computer monitor and in some kind of program, or what does that end up? Is this like a Excel spreadsheet? How can we kind of bring that down to the level that we might kind of be able to picture in our heads?
Yeah. I mean, like a typical almost bar chart dashboard, right? That just gives red, yellow, green kind of signaling around the main domains of community connectedness, spiritual integration, and then capacity. And we kind of landed on those because those are domains that involve, number one, how a community is truly working together. So community cohesion, social supports, social systems. We know from flourishing studies that that's one of the primary indicators of flourishing. And this was a conversation Steve and I had was, can we connect this to something that is more global, like the Global Flourishing Study, which is happening right now? And so part of our work now is testing some of these measures against the Human Flourishing Index as a comparison. So even though we're not embedding a comparison into this impact assessment, it will still allow MAI to say, okay, we're using the Flourishing Index. How do we compare to the national index in Indonesia, for example? They're part of the study. MAI could look at what they have in their communities compared to the national measure, for example. Is it perfect? No research is perfect. But at least it gives us some additional insight that not only Steve, but then the coordinator in Indonesia can use right away. And maybe not change programs, but he can have a really good conversation with his committees and his trainers in Indonesia and say, hey folks, we're actually doing really well compared to Indonesia's national flourishing measure. Or we're behind. What might we be missing? So the dashboard will give the coordinators that kind of score. So one community connectedness score, one capacity score. Even though we're asking 3 questions in each of those areas, they won't get the whole printout of results. They'll get that one score that they can then use and just have a really good conversation about what changes do we need to make to do better, like Steve was saying earlier. Now, could these be used to publish a paper? Sure. And to inform the larger space? But that's what we have in mind for a dashboard, is some kind of red, yellow, green indicator of where a community is. And it'll be on the community level that can then roll up to a country level depending on what kind of information you want, to know how are we doing. And the cool thing about what we're getting also with Steve Offit's work and PLA is that then, for example, if we're not doing so well in community connectedness, we're going to have corresponding PLA tools that the program coordinator can do in that community to actually unpack that finding in the community, from the community, with the community to do better almost within the next few weeks. You don't have to wait for a publication. So that's the reason behind having that sort of dashboard that provides a public-facing means to read the impact assessment.
That's really helpful. Like I was thinking, what are the nuts and bolts? How does this end up impacting our regional coordinators, country coordinators, people on the ground level, from different backgrounds, different education levels, different language proficiencies. So this will be pretty simple as far as the results go. Is there an idea to kind of create some kind of an app or website, or is this kind of shared on a top down level? What does that end up looking like?
The hope and the plan is to have it probably be some kind of web-based application that the country directors can have just direct access to. They don't have to wait for Steve to submit an attachment to an email or something. We were actually really, I think all of us are happily surprised with how fast technology is going. 5 years ago, should we use, are they going to have access to mobile phones or connectivity? What's going to be this? Now it's almost like, yeah, they're going to have something. Like something will be available for someone in a rural community to be able to pull up a web browser or an app. And it's a different world than what it was 5-10 years ago in a good way. And I think also if we can leverage it appropriately, it can also help create equity in data. And that's what we're hoping to do, is let's create equity in data for those in the field. They can actually own it. And we're starting to see that. And Steve, maybe I'd like your feedback on that. Steve Offit works with the advisory committee and has for over a year now, I think. But just to watch them and work with them grow in owning this project as much as we own it. They're providing really helpful feedback. They're pushing back on questions and saying, yeah, this isn't working that well. Can we ask it this way? But they're also getting excited about it. They're also, and they're asking, when are we doing this again? When can we talk about this? And so it's just neat to see this sort of growing hunger and a growing collaborative curiosity. And like I said that earlier, and I'll say it again, because that's really a core value that we want to bring to any work that we do. And I think we see it. I don't know, Steve, if you want to add anything to that.
I think anyone who's worked for a company, who's had a boss, can understand that evaluations sometimes can be scary. Um, so when you say, "Hey, we're going to come evaluate the work that you're doing," I'm sure that that's not, not necessarily great news for anyone, right? It's true in corporate world. It's true as a school teacher. It's true in missions sometimes. Um, and so I think, the journey that we've been on as a community of MAI to sort of say, okay, what are we trying to do here, and how is this going to help us, and what is the information going to be used for, and so on and so forth. Um, I think that Jason's key word there is ownership. Uh, I think there's been sort of a warming to this whole concept, and then sort of an idea of like, well, how can we make this really good, so that we can be better servants of Christ. And so we've gotten to the point where, like, unsolicited, from one of maybe I'll leave the office unnamed, but we got I think it was a 7-page document, and sort of like, hey, this is what we did. This is how we're wrestling with it. This is where it's not working quite as well. This is how we'd like to make it better. This is how we did make it better, unprompted by you guys. And so, just really incredible to kind of see how the tool is being sort of owned and then built, by MAI personnel, and just the privileges to partner with that kind of personnel, and the desire that they have to be the best they can be in the field.
What have been some of the roadblocks or frustrations you've been encountering so far in this journey?
Go ahead, Steve, if you want to start.
There's been some.
Yeah. I guess I'll mention one, which is, it matters a lot to us. I think it matters a lot to MAI, what the spiritual impact is of the work that we do. And so, how do you sort of measure that? And how do you get people talking about that? And so, our tool has tried to generate questions that invite discussions about issues of spirituality. Um, and it turns out that's hard to do. And it's especially hard to do in places that are sort of have plurality of religions, right? In Muslim majority context, right? Like, oh, you're going to ask me about spiritual questions? Like, how am I supposed to respond to that? And so and we're trying to do it really quickly, right? This is rapid impact assessment. And so how do you create a safe place, and how do you ask the right questions to really understand how God is working in these communities? That's hard. And we've struggled a little bit in that area. And so I think it takes more prayer and discernment and wisdom, and strategy. And so we're still working on that issue.
I think related to that roadblock, you also start to see the personalities of the regional directors and coordinators coming through in terms of what the focus is. And I think the benefit of what we're able to do by bringing them together is they're interested in what each other has to say, not just us. Because I think they realize, and we all realize, like, yeah, we all have a bias in the work that we do. And until someone external to us helps to shine a light on another area that we might need to grow into and grow in, it's hard to see it. It really is, because we ourselves by default just want to stay in comfortable places. And so I think the time needed, and it's been great to have MAI be patient with this process, because the time needed to create space for that to happen and get different time zones, people in different time zones, different regions all together has been a blessing, but it's also created challenges to, like, okay, how do we continue to learn from each other through this process? It's not just about developing a tool. It's about building a community and relationships through the process so that it's actually used. A tool that is built and then just not used is a waste. And data that is gathered and not used is a waste. And so part of Steve's question is making sure we get good data and good information that is relevant to where people are right now, but also to where they need to go 2-3 years from now. And that takes some trust equity on both sides. Do you trust us? Yeah, this question about witchcraft and spiritism, it's not comfortable, but maybe it's where we need to go. Do we have, okay, we accommodate a mixed community and also Christian community, because we want to know, if you're a Christian community, are you really moving toward a Christian worldview? That maybe you can ask in a more mixed community. But now we're realizing that adds a level of complexity and a level of difference in questioning that maybe isn't as useful as we thought. So how do we navigate that roadblock where we have just one set of spiritual integration questions, but are at least comfortable enough for both sets of communities to use effectively? Right? This doesn't have to be perfect. And again, that's kind of my own roadblock, is I want this to be excellent. Well, it can also be good as long as it's useful, right? Something that's excellent but really isn't practical, or it's too complicated. And so we're finding that balance among all of us to get to that point.
I think what Jason said about just not being perfect, progress over perfection, and that really is kind of the gist of this, in my opinion. We're not sending a swarm of highly educated researchers over there who are going to be able to, spend weeks and measure multiple other communities that aren't doing Che and gather all the counterfactuals, and but it's progress over perfection, in my opinion. And I think it's just like a good faith effort on our part to do the best that we can. And so yeah, I'm excited about it, and I think it's a worthwhile effort. I think too, just one of the other pieces of this has been really identifying what's the goal. What's the goal for MAI? Because and if you asked 10 different people, you probably would have got 10 different answers for a while, and you still might, honestly. Is it a community transformation? Okay, what is that? Is it a Che village? Okay, what is that? Is it just Che? Those are some of the answers that you would hear. And then you might get some that are focused more on the slant that they take, spiritual change. The goal is people becoming Christians. Like that is the goal. The goal is healthier communities and all the different things. And so trying to really, I think that just kind of goes back to the challenge piece that we wrestled with for a bit. And I've been continuing to wrestle with as for MAI, what is our goal in a community? And, because we can't be there forever, we shouldn't be there forever. The goal, in my opinion, isn't a program. The goal isn't Che. And so it's been a really thought-provoking process to kind of walk through and ask the hard questions that, honestly, these are hard questions because some people are struggle in their mind. It's been one thing for so long, and getting them to kind of rethink that, what is the goal, has probably been one of the biggest challenges that I feel like I've experienced here. But it's been really good, and we've come a long way, and I'm actually really excited about the direction that we're going. So
Yeah, I was thinking something similar about just what is community transformation. Once transformed, always transformed. Or, early in these conversations, Steve and I got talking about legacy Che communities, of communities that have been in the program for decades. And it's like, are they still actually Che communities, or are they done? Are they at a point of health and flourishing, transformation, or do you kind of slide back depending on local leadership, droughts, other policies that come into place, external aid that comes into the community that really disrupts things? So you start having these different dynamics at play that, maybe a community is doing really well, but all of a sudden maybe they're not. And I think that's the value of having this kind of simplified 4 or 5 part dashboard, because from year to year, you might be green in 3 out of 4 and start working on the one where you're red, and then you're red in 2 out of 4 3 years from now. But at least there's a level of awareness in the community, and for the program lead, for the regional coordinators to know, yeah, this is where we need to have a conversation in this community or in this region of communities. And it's interesting, like, I believe that even among what are considered Christian communities, the spiritual integration might be the part where they're struggling, because it's easy to ignore. Let's just focus on the public health, right? But in communities where it's not, you might see a growing emergence of Christian values. Maybe not Christianity, but at least moving in the direction of starting to talk about the values that are from a biblical worldview, which I think can then be the foundation for additional conversations and, like, let's talk about this, right? So, and I'm excited at what this might bring to not only MAI, but other organizations working in this space, just to start having evidence-informed conversations in the field to do better and to love well.
I'm glad you brought that up, that idea that other organizations may be able to take some of this to their own work. What do you envision there? How can people connect with you, and kind of, would they make a partnership, or would there be a tool that they could maybe just jump onto somehow?
And that was part of our conversation early on, Steve, when we were first talking about this, was, I believe, something that we could promote together. I don't think this isn't owned by any one organization. I think both of us feel this passion for informing the sector, the industry of Christian development, that we want everyone to be doing better. And so I think it's it's part of an ongoing conversation is how do we promote this and get this out there so that others can use, learning what we're learning from the measurement piece, from the factor analysis that we're doing behind the scenes. Like, we don't need to repeat these cycles or these studies with each and every organization. But, what does that look like? Publications is part of that process, like disseminating it through a publication, right? We talked about that earlier, and that's sort of the low-hanging fruit, but then being able to talk about it at conferences and co-present and think podcasts like this, Tim, to get the word out of what's possible is part of that.
That's good. I'm wondering too, from your experience, you guys that are more into this kind of stuff than I am, what are some of the trainings, thought leaders, books, maybe universities that would be helpful for people that are kind of attracted to this idea of data, of improving systems based on good research that often is just overlooked because we're just so passionate about what we do, but who has time for the research side of things?
I'll give you, so the Meros Center has, we're growing a couple of courses, research for organizations. It's a real low-level bar to understanding the research process just to become a good research partner. But then there's also an initiative called SEEDS. Bruce Weidick and his group have initiated SEEDS. They've got another level of training on social impact analysis. Economic development economists coming together, create a really cool certificate training. That's kind of the next level up, but it's really good. And then there's additional training you can do. Steve Offit, I don't know if I know you've got some resources in the qualitative transformation space, and he's doing some work in that area too.
Yeah, I just would mention, there's a connection between how we think about Christian development or theory and theology, and then how we measure Christian development. And so it's really also important to kind of bone up on how you think about these things. And so, the classics are sort of Walking with the Poor by Bryant Myers and God of the Empty-Handed by Jai Kumar Christian. And there's some more recent books out there as well. But these are still probably some of the seminal, really foundational sort of texts that we have to help us think about what it is we're actually trying to do when we do Christian development. And then attaching that to methods of measurement in ways that Jason talked about and Bruce does with SEEDS, I think are really good ideas.
Yeah, I'd also just plug a book called The Goldilocks Challenge, and it's called Right Fit Evidence for the Social Sector. And, it's kind of basic for people who aren't necessarily studying this so much, aren't researchers, but it's really powerful because, just some of the things that stand out that when I read it was, don't really think even so much about evaluation if you're not even currently doing good monitoring. If you're not even really measuring your outputs, then you can't just jump right to evaluation. You've got to figure out really where you're at and what your organization is actually capable of doing, and so I found that to be a really good book. And then even Peter Greer's book, Mission Drift, there's just a chapter in there that's fantastic. Short chapter, super easy to understand, that just kind of really plants the seeds for the value of doing something. And I love one of the stories he tells about, one of my friends used to call this evangelistic measurement, but basically like there's a lot of, unfortunately, and I hate to say, it's a lot of Christian organizations, a lot of development organizations, they're sort of evangelistic and they're sort of stretching what's really happening. But, if you look at in Mission Drift, he talks about, if you look at all the data that's come out of Haiti, how many salvations there's been reported from so many different organizations. He said Haiti would have been completely saved every 3 years. Okay. And you hear this from other places too. I mean, I hear incredible reports from South Asia on different things like this. And you think, wow, if those numbers are really happening all the time, I mean, you'd hit the billion people pretty quick, because we know how exponential measurement works, right? And exponential things happen. So I don't know. I think those are just good, and they've been really just insightful for me. Just kind of just basic book you can pick up and learn a lot.
Great. This is good resources. Let's look at our ways to get in touch. Jason, how can we learn more about Meros? And then Steve, how can we learn more about medical ambassadors?
meroscenter.org, MEROS, or email me, jason@meroscenter.org.
Yep. And same medicalambassadors.org. So, or yeah, you could email us as well, steve@med-amb.org or LinkedIn, Facebook.
Fantastic. Steve, do you have anything to plug?
Uh, I do have a new organization myself called Empower Transformation. So you can hop on there too. I'm at Stephen with a PH .w.offit@gmail.com.
And Steve, I guess we'll have to cross that name off our list of potential name changes. So
Yeah.
thanks for that.
Oh.
Well, thank you so much for joining us. Yeah, I'm. This is not my realm at all, so this has been pretty informative to try to talk to data people, and something like I've been telling Steve as I've been working with him for a while, that for me it's like there's scaffolding that is so often overlooked, and as especially my background as Christian nonprofits, as we try to do all this good work, we often don't have that scaffolding set in place. And so it's often this, you're reaching for the sky without having any data. You just expect that the Holy Spirit is going to move in a big way, but maybe he's got different plans. I mean, so this is just, for me, very comforting to know that there are statistics and data that I don't understand, but it's being pulled together by people that do understand it to help us get the best results. So thank you for using your intellect in this way. This is really encouraging, and I just really am excited for where this is going to go, and also how other organizations are going to be able to learn from this and even take it another step further, and then share that back with us. This is kind of an interesting time, especially with all the AI tools that are able to help collect that data and give us different kinds of tools and ways of figuring this out. This is a exciting time.
It definitely is. And I just want to say I'm super thankful for Jason and Steve and Alicia and May and other people at Meros. This to me has like been one of the most beneficial collaborations and partnerships I've been part of. Because you see partnerships and sometimes they're kind of like 90-10, you know what I mean? Or not that helpful. Someone just wants something that you have. But I feel like this one has been very inspiring, encouraging, and I'm just really excited about what's being developed here. So I just want to thank you guys a lot. Really appreciate it.
Thank you, Steve. It is like Steve and I have had a couple meetings this past week, and I'll say it's just been a blessing to be able to be part of this ecosystem and to actually be in the body. I feel like there's just the body is present, and you don't feel like we're off in a silo, just kind of creating something, but actually creating something that's meaningful. So, yeah, thank you, Steve, for the opportunity. I agree.
And my one takeaway let's just say a takeaway was its progress over perfection. Is that how you said it? Is that something you guys coined, or is this a phrase that I've just never heard before?
I think I maybe have read it somewhere, pretty sure.
Yeah, it's a really good way of picturing what we're trying to do. We're not trying to be perfect, but we want to see, progress and everything. So great. Have a great day, guys.